with is weight. So one of the worst things you can do for your back is to weigh 400 pounds, right? Because every pound that you put on your body, you're putting multiple pounds through your lumbar spine, and the lower down the spine you go, the more weight it's got to hold. So as
400 pounds is pretty extreme.
It's extreme.
So let's get real.
Yeah.
Like, what's, in your opinion,
yeah,
how much should people care about what they weigh, and what would be considered obese
sure
versus healthy?
Yeah, so this comes up a lot because, so we use BMI in our computer just like everybody else does. So the BMI comes up and they have their own readings for what that means. So I'll tell you, I'm 6 foot tall. I weigh like 192 pounds. I should weigh like 182, but whatever. I have little kids I'm chasing after. But if you look at the thing, I'm either overweight or really close to overweight. And maybe I'm biased, but I don't really feel like I'm super unhealthy.
Right.
So I don't know that those numbers are really the cutoffs that we need. I think, assuming that you're not someone who's a professional athlete, because like a left tackle on a football team is morbidly obese, but is very healthy for the most part. I think what I would say is, if you take your ideal body weight, which is, for a guy that's 6 foot tall, my ideal body weight's probably 175 or so. If you take that and you add 50 pounds to it, it's probably a little much, and at that rate, you're normally not in the overweight, but you're in the obese category. If you find that your weight is in the obese category, which is a BMI of over 30, it's probably worth considering whether or not you need to lose some weight, or if you're there for good reasons. If I, went back to when I was in college and I was weightlifting and stuff, then my BMI was close to that, but I was not unhealthy, and I was doing the right things, and so there are exceptions to the rule. And I have a patient who is a bodybuilder here his BMI is 32, and he shouldn't change anything. So there are situations that are exceptions.
Right.
The problem is, outside of those glaring exceptions, we don't want, almost everyone comes up with a reason why they're there, and then that might be the reason why they're overweight, but that is not necessarily the reason why it's acceptable to be overweight. And so as I talk to a lot of people about weight loss. It's a very common topic I get into. I'm very careful to hit on a few points. It's not personal. It's not a judgmental problem. It is factual. The number's real. And there is absolutely a path to fix that problem. And then I always end with the same thing. I'm not saying it's going to be easy. I'm saying it's worth it. And that it's worth it to, not only, in some of these patients, they can't have surgery because their BMI is too high. BMI over 40 in most situations precludes you from surgery. So patients,
especially spine surgery.
Absolutely. Our infection rate goes up, complication rate goes up. Patients are always shocked to hear that the insurance company has been cashing their check but will deny their surgery based on their weight. I tell them that it will fix other things. Sometimes they don't even need me after they lose weight, which is great. But then if they do, we can mitigate those risks. So outside of the surgical population, to get back to what you were talking to, if you're 50 or 60 pounds over what your ideal weight is, and you can see that online for whatever your height and body composition is, then I would seriously think about not a diet, but a lifestyle modification. What's one thing I can change every week? What's a way I can cut out 100 calories a day that's sustainable? What's a way that I can walk for 30 minutes more a week than I'm not now? Or some activity I can get involved in exchange for another one that's more active than the one I'm involved in. Little things, but they have to be sustainable, because the diet just ultimately ends up in more weight gain.
So would you say that 50 or 60 pounds, is that for a male frame and a female frame?
That's tough. How tall are you?
5'2".
Okay, I was going to say, so shorter women complain about this all the time, because if you're 5 foot tall, for instance, if you gain 10 pounds and I gain 10 pounds,
it's very different.
It's different, right? Like I can hide, I got more places to hide that. So it's tough, because for women that are 200 pounds, if you're 200 pounds and 5'11", it's not a big deal.
Right.
And the only reason I'd say it's different is not so much because of the gender differences, but because there's just not as many guys that are 5 foot tall.
Height difference.
So it's a height difference where it really matters. And that's why the BMI does take that into account a little bit. And some of this is not an exact science, but it's, with people outside of medicine, it's I had a look in the mirror moment where I was like, oh man, we got to change this, But from a health perspective, I'd say I don't want people to, there's probably a more PC way to say this, but like body positivity is great, because we should all be comfortable in who we are and what we do every day, and our interactions with people, and what we're going to do, and the impact we're going to have. But in the same regard, it's how I look at how I deal with the country. If you don't like something about the country, it's okay to say that, because you care about it. You want them to change something, make something better. It's the same thing with your body. You should be able to be confident in who you are and what you are up here, and still be able to say, but I want to change this about me to get the best me out of it. And I don't think those are mutually exclusive thoughts.
Correct.
And I bring that up just because some of the body positivity movement has resulted in people saying, like, accept me for who I am, at what, as a physician, I would say is potentially unhealthy, and that worries me because I want people to be as healthy as they can be.
But we know there's a relationship between being overweight and back pain.
Yes.
Okay.
Correct.
All right. Anything else? What about hydration, water intake? Is that important for spine health?
I think indirectly, the discs